Pediatric orthopedics was sort of a very comfortable and sort of natural subspecialty for myself. Growing up, I'm from a large Italian family, so there were 10 kids in my family. Specializing in children's orthopedics was pretty comfortable. You want them to have excellent medical skill, excellent training, but it has to be someone that there's good communication back and forth, where you're comfortable receiving information in a way that you can process it and use that information, and you feel comfortable also asking questions and getting clarification if there's something that you're not from. So I think that's a real important part. I think sometimes in healthcare, when that is lacking, when the communication between the physician and the patient or the parent is lacking, that's when things sometimes aren't done optimally when that's the case. So I think that's an important part of choosing a physician. It's a pretty unique practice because we have so many subspecialties. And if you look in the United States, there are very, very few private practices that have pediatric orthopedic specialists. And I think it was really the vision of really the founding members of the group who really embraced having pediatric specialists in the group. Most private practice groups shy away from them. They're like, oh, we don't want a lot of crying children in the office. They're very uncomfortable. And I think when they saw how many children were in the West County area, they realized that they would really be beneficial if they had pediatric subspecialists as part of the group. But the fact that we actually have such a variety of subspecialists, including pediatrics in our group, makes it really different. I think just that balance. I think, in all things moderation. So I think making sure that you're eating healthy, having a variety of foods and the appropriate portion size is real important. I think, sometimes we get so focused on, oh, I'm a pianist or I'm a violinist, that all you do is music and you miss out on the other things there in life. I mean, you don't do physical activities to stay fit. And so there's those patients tend to have problems because they're not active enough. And then my other patients who are overly active, so they're playing soccer, but they're on 4 soccer teams or 3 baseball teams, and they're having lots of overuse problems. So they're doing way too much activity and developing stress fractures, for some of my runners. So I think having a balance, and so I think doing a sport is great, and being fit is important, but you need to have balance. I think it's good to be balanced, not only in the athletic side, but also to be active in the musical side and in the academic side. So I think having a really healthy lifestyle, I think, incorporates that.